This facility is one of its kind in India and rolled out the country's first varicose rabies vaccine in the year 2000. Today, we are a leader in anti-rabies vaccine segment with presence in around 60 countries. HBI has launched several other vaccines and become a major player in the human vaccine segment. HBI has been a key supplier of a pentavalent vaccine to the Government of India under its Universal Immunization Program. In yet another milestone, HBI introduced Havishur in 2024, India's first indigenous hepatitis A vaccine, aimed at providing protection for both children and adults. With the vision of shaping global healthcare by spearheading the One Health initiative and the mission to innovate, produce, and market quality healthcare products and services to improve and extend lives. We are committed to providing affordable, high quality products through continuous technical innovations to meet our customers' need. As a market leader, we have taken a significant step towards reducing plastic burden by 160 tons per annum through the introduction of eco-friendly packaging of our flagship brand Abhara. As a part of our corporate social responsibility initiatives, we have adopted schools where IIL provides infrastructure support and basic facilities, including assistance with the midday meal program in association with NDDB through the gift milk program. Hundreds of school-going children benefit from daily milk nutrition. We have also donated an oxygen generation plant to Telangana Institute of Medical Services and Research. These are just a few highlights about IIL. For more information, please visit website our www.indimuni.com. It's my pleasure to introduce our esteemed speaker for today's session, Ramana Arella. Dr. Arella is a general physician based in Hyderabad with extensive clinical experience. He practices at Sri Saikalpana Clinic in Yusufguda, Hyderabad, Telangana, where he is known for his dedicated patient care and strong clinical expertise. During today's live talk, he will explain why pre-exposure rabies vaccination matters, drawing on his long experience caring for patients at the community level. Now, let's warmly welcome Dr. Venkata Arella, our today's speaker.
Hi, everyone.
Good afternoon, Doctor.
Very good afternoon.
So now, we shall be beginning today's session with some commonly asked questions on the topic.
Yes, please.
To begin with the question, what exactly is rabies and how does a person gets infected?
Yes, it is a pleasure to talk with you regarding the rabies. So, rabies is a viral disease caused by the rabies virus, which attacks the brain and the nervous system. A person gets infected when the virus enters the body through bite, scratches, saliva entering broken skin or eyes or mouth. Once inside, the virus travels slowly through nerves and towards the brain.
Yes, sir. Thank you for this information. Could you please tell us why is rabies considered dangerous if someone gets infected?
So it should be considered as a dangerous because rabies is one of the deadliest diseases known to human. Once the symptoms appears, it is the almost 100% fatal. So there is no cure once the disease reaches the brain. So treatment must be before symptoms appears. Otherwise, survival is extremely rare.
Okay, thank you, sir. Could you please explain what exactly is pre-exposure vaccination against rabies?
Pre-exposure vaccine is a preventive vaccine given before any bite happens. So it prepares your immune system to respond faster if you are ever bitten by an animal. Yes.
I'm also curious to know the difference between pre-exposure vaccination and post-exposure vaccination.
Yes. Pre-exposure vaccination given before any bite for people at a higher risk are 2 to 3 doses depending on the schedule, makes post-bite treatment simpler. So it is a pre-exposure. So post-exposure is given after a bite for everyone bitten by an animal. So wound washing plus several vaccine doses may also be also need rabies immunoglobulin. So without pre-exposure treatment is more urgent and involve more steps. Yes.
It was very helpful, sir. Now I believe our audience has a clearer grasp of a difference between the two, that is pre-exposure and post-exposure vaccination.
Yes.
So, in your opinion, who should think about getting pre-exposure rabies vaccine?
It is pre-exposure rabies vaccines are recommended for children living in areas with many stray dogs, pet owners, veterinarians, with veterinary doctors or veterinarians who are handling at the veterinary clinics and hospitals, animal handlers, people working in labs with rabies viruses, travelers to rural areas or forest areas, wildlife photographers, trekkers, campers, people with limited access to medical care. So,
Yes, sir, absolutely true. Especially for those with pets or kids around, why pre-exposure vaccination is important for children and pet owners?
for children, often play with animals, get bitten without telling adults, don't understand the danger. So their wounds may go unnoticed, high risk. Pre-exposure vaccination gives baseline protection. So for pet owners, even vaccinated pets can occasionally get infected from wild animals. Handling pets, cleaning wounds, breaking the pets also exposes owners. Yes.
Yes, sir. Thank you, doctor. That was a very clear and helpful explanation. Could you briefly explain that what are the benefits of taking rabies pre-exposure vaccination?
Yeah, definitely. Protection, even if the bite is not immediately noticed. Number one, removes the urgent need for a rabies immunoglobulin, which is often unavailable. Post-bite treatment becomes simpler and cheaper. Peace of mind for people exposed to animal daily. So lifelong immunity can be maintained with the periodic boosters.
Yes, sir. Thank you. That was clearly highlighting the benefits of pre-exposure rabies vaccination. So, please tell us the dosage of pre-exposure vaccination and is the vaccination safe?
Yeah, it is the very safe and it is recommended by WHO. Two schedulers, 2 or 3 doses you can give day 0, day 7, and day 0, day 3, day 7, or day 0, day 7. 2 or 3. It is the very
Yes, sir.
safe. It is safe and well tolerated. So no any reactions. It is safe in children's, adults, elderly. Yes.
Yes, sir. True. I would also like to ask if a person gets pre-exposure vaccination, does that mean the person is 100% safe if bitten by an animal?
Uh, why? Because no vaccine gives 100% protection, but pre-exposure vaccines gives strong immunity. Even after pre-exposure vaccine taken, if bitten by the stray dog, wound must be washed. 2 booster doses, day 0 and day 3, are still required. So pre-exposure vaccines reduce the risk drastically, but it does not eliminate the need for post-bite boosters.
True, sir. Thank you for clearing this doubt because many of our audience might be having this doubt.
Yes.
Then, what special guidance do you have for people who travel to or stay in rural or remote areas regarding rabies prevention and handling animal bites?
Yeah. So they should be stay away and avoid the touching any stray animals. Does not disturb animals when they are eating or sleeping. So keep children away from dogs, bats, monkeys, like cats. When traveling, know the nearest health facility that stores anti-rabies vaccines. If bitten, wash the wound thoroughly for 15 minutes with soap and water. Apply antiseptic. Go to hospital immediately. Do not stitch deep wound immediately. So do not apply turmeric, soil oils, or home remedies. Huh? So rapid action saves lives.
Thank you, sir. Thank you for clearing this question. The next I would like to ask is how long does protection from a pre-exposure rabies vaccine last, and will a booster dose be needed later?
Yeah, definitely. After the initial two doses, immunity lasts for a year. So, who are WHO says boosters are only needed in high risk individuals depending on exposure. For average pet owners and children, a booster after 1 year may be advised, followed by booster every 3 to 5 years, depending on the risk. Yes.
Yes, sir. I would also like to ask what should people do immediately after an animal bite, even if they have already done pre exposure vaccination, and why is timely action critical?
Yes. Immediate steps we should take. Wash the wound for 15 minutes with soap and water. Apply antiseptic. See the medical care within a few hours. Review two booster doses on day 0 and day 3. Why urgent
True,
mean?
sir.
Because the rabies virus enters the nerves quickly. Early cleaning removes up to 90% of the virus. So even vaccinated people needs a booster to fully neutralize the virus. Yes.
Yes, sir. Very true. Can kids, elderly, or people with health problems safely get pre exposure rabies vaccine?
Yes, definitely. Kids completely safe, elderly safe unless severely ill. People with chronic disease like diabetes, hypertension are very safe. Pregnancy is safe if required. Immunocompromised patients can take, but response may be weak. Rabies vaccine is not a live vaccine, so it cannot cause rabies. That is important.
Yes, sir. Very important.
Yeah.
I would like to ask that are there any other animals except dogs that people should be careful about?
Yes, many people they take the anti-rabies as if only they bitten by the dog, but other animals they will forget like cats, monkeys, bats, wolves, foxes, jackals, cows, buffaloes, horses, any animal that shows abnormal behavior. So birds, reptiles, insects do not spread the rabies actually. That is so mainly household animals like this cats, bats also they will live in houses, old houses. Cows, buffaloes, horses. We are accompanying with these animals in our houses, our gardens, like this.
True, sir. Very true. Uh, doctor, what is the most important message about rabies prevention and pre exposure vaccination that everyone here should remember and act upon?
Yes, rabies is 100% preventable disease, but only with timely vaccination. There is no cure if they get the disease. So only it is a preventable. It is 100% preventable. Once the symptoms appear, it almost always fatal. 100% fatal. There is no treatment. Pre-exposure vaccine gives a powerful early protection. Every animal bite must be treated seriously. Immediate wound washing and prompt vaccination. So, vaccination before exposure, quick action after the bite. So, it gives the complete protection.
Yes, sir. So, what is the take home message of yours to our audience?
Yeah. So, Once they exposed to animal bite, they should wash the wound with soap and water immediately and take the vaccination. It is a post exposure. When post exposure, they should take the five vaccination if they are not previously not taken the vaccine, pre-exposure vaccine. If they have taken the pre-exposure vaccine, they should take booster doses day 0 and 7. Yes.
Thank you, sir. Thank you so much for this answers and highlighting the brief information about why pre-exposure vaccination is very important. So, while concluding the program, I thank you for being the part of the live talk Fearless Against Rabies. We hope today's session was informative and valuable in spreading awareness on rabies pre-exposure vaccination, why it's important. Our special thanks to Dr. Ramana Arella for sharing his time, expertise, and insights with us today. For those who would like to revisit the program, the video will be available on our official social media platforms. Please follow us on Twitter, LinkedIn, Facebook, and subscribe to our YouTube channel. Do like, share, and spread the word to as many, including your friends, family, and relatives. Until we meet in our next live talk, stay healthy, stay aware, and please take good care of yourself.